let us know the posology. What is posology? Homeopathic posology, Greek word which is posos. That means how much. Logy is study. That is the doctrine of dosage. As I said, it is the remedial, according to the case, finding out the remedy, deciding the dispensing dosage, that is how much time we have to give, what is the quantity we have to give, in what form we have to give, and the repetition of the dosage. So generally in our practice, we practice with the potencies like 200 and 1M. Why? Then what are the potencies needed to treat the cases? Can anybody tell me that why we generally practice with 200 and 1M potencies? You can unmute it. You can say something if you want to say something.
Difficult to keep all the potencies. Lack of space.
Okay, one thing. Then any other thing? So what are the criteria to know to select the potency and to go higher and to go lower? So what are the criteria that we have to do? Let me see with those things. So potencies. So the homeopathic medicines are usually given in potency form. Again, potencies, when we say potencies, it is a controversial subject and it's an issue going on. As we all know, the other fraternity people says dilutions has nothing. Dilutions are giving the placebo effect. It doesn't contain any material. It doesn't have any material, starting materials of the prescribed medicine. Is it not what we are facing today in the potencies? So, as we all know, 10 years back, in 2010, in the Bombay IIT, Bombay Institute of Technology, they have made a study on potencies where they had released a document that in the potency forms, whatever it is 200 above the potencies, if we prescribe argentum nitricum, argentum metallicum, aurum metallicum, whatever it is, they have made it that potencies after dilution, after 30 potency, after 200 potency, it will retain the original starting material. They had made an research on this and they have documented well about the potencies. And this is the document. Are you able to see it? I'm not able to enlarge it today. If somebody wants, I can send a PDF afterwards. In the second paragraph of it, they refer, the paper reports the fascinating observation that certain high potency homeopathic remedies made from metals still contain measurable amounts of starting material even at extreme dilutions. Can you see that? In the second paragraph it is there. So on the basis of this, it has got nanoparticles. On the basis of this, we can show to somebody else who tells us potencies have nothing, it is just in water, it is just in alcohol, something like that. We can show it to them that it has nanoparticles. So next, a well-selected remedy may fail because of the wrong dosage. In our clinics, what happens is, we'll come to the conclusion of the remedy after taking a case, after repertorizing it, we'll come to the conclusion that this remedy suits to the case. If the potency is wrong, we may fail because of not fulfilling the action. Please mute the microphone. Please mute the microphone. And dose as well as remedy must be adjusted to the patient's need. This should be there. After selecting the remedy, the potency should be correct and it should be adjusted to the patient's need. What is the patient's need? We'll see on that. And Newton's third law. Anybody knows about this? Newton's third law? Can anybody speak? What does it relate to homeopathy? Newton's third law? You can please unmute it and you can speak. What is the Newton's third law relate to homeopathy? Can anybody knows? Okay. Newton's third law is action and reaction are
equal and opposite reaction.
yeah. Action and reaction are equal and opposite. So on the basis of this is the law of cure. Newton's third law implies the law of cure where the opposite action of the large and small doses of medicine. The doctrine of dosage is like the law of cure based upon the discovery of opposite action of large and small doses of medicine. That is a Newton's third law. Action and reaction are equal and opposite. Can anybody give this? Can anybody say some example on this? How does it relate to this? How can we correlate? Based upon the discovery of opposite action of large and small doses of medicine. What happens in the proving? What happens when we prove on a healthy human being? It shows the symptomatology of the condition, right? It gives the symptoms. Then the small doses of it, when we give it to the patient suffering from it, it will cure, right? So homeopathic remedies are never used in physiological doses. This statement is even true even in those cases where low reactive power of the patient sometimes require material doses. Can we use it or not, the physiological doses? Homeopathic medicines are never used for their physiological effect. How? In the mother tinctures form. Now what about mother tinctures? What about allopathic medicines where they use material doses? Can anybody tell? Some of them are very much seen about the mother tincture practitioners. They prescribe mother tinctures especially for diabetes, hypertension. They give Syzygium jambolinum mother tincture, Rauwolfia mother tincture, Gymnase sylvestre mother tincture. Have you seen those? So what about mother tinctures then? What happens when you prescribe mother tinctures to the patient? And what about allopathic medications where they use material doses? They don't have potency. Can anybody? See, can I move on? Or anybody? What happens in mother tinctures? In allopathic medicines, where they give material doses, what happens? Are they stimulating the immune power, immunity, or the medicinal doses are acting? Then why can't we prescribe on the mother tinctures form? Why are we using potencies? See, as I said, the physiological doses is not allowed in homeopathy because what happens is after certain doses, when you prescribe the material dose, for example, mother tinctures, it may be when you prescribe a mother tincture, it will act to the certain period of time. Then the action exhausts. Then the patients require potencies. When the potencies is prescribed according to the case and When the higher potencies is prescribed, then the cure occurs, as all the stalwart says, as all the record says. So that's why when you prescribe mother tinctures, it has to be repeated, not with a single dose. As we practice in potencies, when we give pulsatilla 1 m, pulsatilla 10 m, the one dose or two doses, it will cure the patient, but not in the mother tinctures form. We should repeat. After certain time, the mother tincture action also exhausts, and we don't know, and it may start proving. It may start proving with the patients. Same thing, the allopathic medicines, why they can't do, because that's why they repeat the dose. If you take the antibiotics, they give it for 7 days, 14 days. Is it required? Our medicines, when we treat acute cases, is it required to give 14 days medicine, 14 doses will give? No. One or two doses, 3 doses maximum, it will cure. The physiological action of the drug is not its therapeutic or curative action. That is why it is. Rather, it is pathogenetic. Suffering of the organism produced by the drug is expressed in symptoms which are the language of the disease. Can I give some examples of this? Suffering of the organism produced by the drug is expressed in symptoms which are the language of the disease. The best example is cinchona bark experiment, which was done by our master, Dr. Hahnemann. Therapeutic means curative, healing, and alleviating. That is the meaning of therapeutic. Therapeutic dose must be capable of producing a slight temporary aggravation of the existing symptoms, not the new symptoms. And it should be followed by amelioration. That is the therapeutic dose. The homeopathic dosage should be therapeutic, not the pathogenetic. Okay? The therapeutic dose must be capable of producing slight temporary aggravation of the existing symptoms, but not the new symptoms, followed by amelioration. That shows the curative action of the remedy. Action of the drug. Homeopathic drugs acts upon the identical tracts involved in the disease process in a manner similar to the action of the disease producing cause itself. How does the disease occurs? In similar way, the drugs acts upon the identical tracts. Okay? And what are the 5 considerations for the choice of the remedy? First is the susceptibility. And all we should know about the susceptibility. Then the seat of the disease. And the nature and intensity, which is very important. How is the intensity in acute cases? We should know about all those things. The stage and the duration. Since when the patient is suffering. And the previous treatment of the disease. This is also very important in selection of the potency. Why, I will tell in the future slides. So this is the 5 consideration to the choice of the dose. So when to prescribe higher and lower potencies? Can anybody? When can we prescribe higher dose, higher potency? Or when can we prescribe lower potencies?
We can prescribe high dose.
Pardon? I didn't get you. Hello?
Mind symptoms, we can prescribe high dose.
Why not in any particular symptoms? Can't you prescribe high dose?
Also, where it is aesthetic and require, we can prescribe in 1 m, 10 m.
And there is no pathology.
Okay. Any other answer? Okay. Good. Then? Whereas one remedy, characteristic symptoms is clear. Give the high potency according to the prescriber's degree of confidence. So, I would like to share something about this. Where in the drug proving, we can see in the Materia medica or Materia medica pura, there is a list of characteristic symptoms in a case. When they prove the drug, there is characteristic symptoms. When do we get the characteristic symptoms is while proving. While proving, once we get the characteristic symptoms, then if it is seen in a case, then it is shown the PQRS symptoms, then higher potencies can be prescribed. On the basis of that, higher potency can be prescribed. In children and young, medicine should be given in the medium or higher potencies. And higher potencies are best adapted to sensitive persons, to intelligent, intellectual persons, quick to act and react and impulsive persons. We can think of these things. When the patient is very intelligent, is very quick in reacting and is very impulsive, then you should think of higher potencies. Lower potencies and larger and more frequent doses to torpid phlegmatic persons, where the person is very sluggish, very lazy and very coarse fibered, we can think of lower potencies. When you sit in a clinic, when the person is, the patient comes who is very sluggish, who is very coarse fibered, you should think of lower potencies. And in person who take large amount of stimulants like whiskey, drugs and low potencies. When we ask the habit, if the person says, yes sir, I'm an alcoholic since long years and I take daily, so we can think of low potencies and get stimulated. The person will be in regular stimulation by taking some stimulants like alcohol, whiskey and all. That's the reason why we tend to say for the patients to avoid perfumes, deodorants, because they get stimulated. The repeated stimulation. So in the terminal cases, when the patient does not react to well-selected remedies given in potency, resort to the lower potency and increase the dose to the point of reaction. This happens now in our experiences when we treat in the case when they are not responding, when the allopathic, when they shift to allopathy, then the allopathic doctor prescribes some remedy, they will recover. How? So we can also think in other way that if the cases is resorting to the allopathic side, if the case is dropping towards the allopathic side, where we can't do anything after prescribing some potencies, when you prescribe a case of 200, 1M, 10M, not doing anything, we can think of lower potencies. We have the experiences after treating that they don't have any much result with this, so they go to allopathic doctor, within 1 or 2 days they get better. At that point of time, we should think of lower potencies. Lower potency may help to the cases. Then we should increase the dose to the point of reaction. After giving the low potency, there will be some improvement seen in the case. There will be improvement in the generalities, there will be improvement in other things. After that, we should increase the dose to the point of reaction. Then it will cure the case. So idiots, imbeciles, deaf and dumb, person who have taken many crude drugs of allopathic, homeopathic often require high potencies. Here also another hint I can give you. If the patients come from the allopathic side, they'll say, sir, I'm taking allopathic treatment since 10 years. Since 15 years I'm taking it, sir, but there is no relief. In these patients, you can start with higher potencies. You can go for the 1M, 10M potencies because they have taken the material doses. We can see the diabetes patients. The diabetics comes to the clinic, they are having diabetes since 10 years. After in the blood glucose level will be 300, 350 mg per dl after that. So they said that, sir, I'm taking the allopathic medicine since 15 years, sir, but the blood sugar is not getting controlled. In those cases, after taking the case, after coming at the remedy, you can think of hypotencies. Hypotencies will definitely stimulate it. So what does the stalwart says? What does Hahnemann say? In certain malignant and cases like typhoid may require low potencies of the indicated drug. And no-shots, and you should not forget about the no-shots. No-shots like sorainum, syphilinum, medoinum, tuberculinum also be remembered in those cases. A single dose of no-shot in moderately high potency will sometimes clear up a case. This has happened lot of times in my clinic when I'm taking acute diseases, where he is responding well, but not to the complete mark. When it comes, we can think of no-shots. If it fits the case. Sorainum, syphilinum, medoinum, tuberculinum. And what does he say in the organon of medicine? For 6 and 7 is manifestation of disease, where the symptoms and signs, the patient himself gives it the symptoms and signs, and the persons around him, if they accompany, the patient's accompanied with his wife, his father, his mother, persons around him, and the physician's observations. It is very important. Each and every case, the observation should be there from the physician point of view. Physician's observation, that becomes the portrait of the disease. We should consider all these things to get the portrait of the disease. And what does the Hahnemann recommends us? Just give a single dose of the indicated remedy and await its full action. The duration and action of the remedy varies with the nature and rate of progress of the disease. Can anybody see in the Boric Materia Medica, there is a separate section of the action duration of, right? He gives, for example, Restox, the action duration is 7 days. He gives Merxol, action duration is 20 to 30 days. What does it mean? In chronic cases, it may, but in acute cases, it's a different thing. That's why he says the remedy way.
ಗುರುವೆ ಒಂದ್ ನಿಮಿಷ ಗುರುವೆ, ಇನ್ನು ಹಿಂದಕ್ಕೂ ಮುಂದಕ್ಕೂ ಓಡಾಡಂಗಿಲ್ಲ. ಈ ವಾಯ್ಸ್ ಕೇಳಿಸ್ತಿಲ್ಲ, ನಾನೇ ಮ್ಯೂಟ್ ಮಾಡಿದ್ದೀನಿ ನಿಂದು. ಹಿಂದಕ್ಕೂ ಮುಂದಕ್ಕೂ ಒಂದ್ ಕಡೆನೆ ಮಾತಾಡ್ಬೇಕು. ವಾಯ್ಸ್ ಬ್ರೇಕ್ ಆಗ್ತಿದೆ.
ಓಕೆ.
ಸರಿ. ಕಂಟಿನ್ಯೂ ಮಾಡೋಣ.
The duration and action of the remedy varies with the nature and the rate of progress of the disease. Again, in the cholera, now there is no cholera cases. In cholera, the action of the remedy might be exhausted in 5 or 10 minutes, and another dose may be required at the end at that time. So Hahnemann has given those doses at the time where it gets exhausted in 5 to 10 minutes. After 10 minutes, the medicine has to be repeated in the cholera cases, a fatal disease. Now it is not there. So what happens in tuberculosis? In TB, the action of the dose might continue for 2 to 3 months. Single dose. The only rule, what can we follow is, repeat the dose when the improvement ceases. Allow a dose as long as improvement produced is a good practice. So we should be very much aware of this. And Dr. Vijaykar says, homeopathic reactions and aggravations are changes occurring vital organs and changes in superficial tissues and non-vital organs. As sir has been said in the theory of suppression, that as we all know, after treating the layers, if it is in a 5th layer, if it is in a 3rd layer, after treating with the medicines, to which layer it has come, to which layer it has gone, The sir has given clearly in that book. So what are all the good signs then? The good signs is the slight aggravation of the symptoms, that is the existing symptoms, and appearing quickly after giving the dose, and it should be disappear followed by amelioration without producing any new symptoms. That is one of the good signs after prescribing. And it calls for the suspension of medicine. So if it happens, so please wait. It is the best evidence of the curative action of the remedy. It shows the curative action of the remedy, then the cure follows. Changes in the patient. So what can we expect in the changes in the patient after prescribing? Can anybody say? What happens in the acute? What happens in the chronic? What has to improve first? What has to improve second after prescribing?
Generals have to get better.
Okay, then we can see with the effect of the remedy. What happens in the acute and chronic, and what happens in the cancer cases. In acute, physical generals should get better first. Particulars also should get better in 48 hours of time. Physical generals has to get better first. As we all know, patient has to eat well after prescribing. The weakness should go. He has to get appetite back, and he should get active. He should get interest in her daily duties or in her routine works. Then the particulars should follow in 48 hours of time. Now what happens in the cancer cases? The particulars should improve first, then followed by generals. When the improvement ceases or old symptoms reappear and remain without change, it is the time to repeat the dose. And in our daily practice, it happens after prescribing remedy. We can see the improvement, but after some days, after some time, the improvement ceases and the old symptoms may reappear, and without any change. After that, there is no progress. There is a paucity of symptoms. Then it is the time to repeat the dose. Then we can repeat the dose at that time. The remedy may be quick with a short amelioration followed by relapse to the original or worse condition. The remedy may be partial similar or insufficient dosage. When this happens, we should think of changing of remedy or changing of the dosage. If you are confident enough with the remedy is correct, then we should think of changing the potency. The dosage is insufficient. You can vary with the dosage. You can vary with the potencies. So in beginning and in suspicious and in incurable cases, if you get a case after taking the case history, you are under confusion and you are not so sure, or the patient may not given the clear case. It happens in the daily practice. Some of the patients give clarity, some of the patient does not give any clarity about the case. What shall we do at that time? And we are under confusion with 3 to 4 drugs, 4 to 5 drugs when we repertorize it. The history is not clear by the patient. So at that time, begin with 30 potency. Begin with 30 potency, you can wait, then you can go to 200, then to the higher potencies, 1M, 10M and 50M. Okay? At that time, you do not directly jump to the 1M, 10M potencies if the case is not clear. You can give 30 potencies and you can wait and watch, and you can increase the potency after the next follow-ups. And what are the difficult things to learn is to wait. It has given in the aphorisms 245, 246, 247 and 248, where wisdom, courage, the patience. If you have wisdom, and you should be able to have courage to take some cases. If you have courage, and you should have the patience to wait and watch. That is why I have put it in the patience in upper part where it is have got a large scope. So then I'll show a case where the posology is very, very important. What happens? The case was on 24 December 2018. It's a known case of subclinical hypothyroidism since 1 month, was presented with the symptoms of hair fall, increase in weight, headache right sided, and pain in the right side of the cervical region of the neck. The constitution medicine was started with Lycopodium 200. I'll not go in detail with the case because the topic is posology, so I'll go into stress on it. The constitution decided was Lycopodium 200 I prescribed that. So what can we expect after this? Can anybody? The thyroid profile was advised to repeat after 3 months of treatment. TSH value reduced from 11 to 5.6. Is it good sign or the bad sign? You can unmute it and you can speak. Is it the good sign or the bad sign? After thyroid profile. Okay. The patient was on placebo for a month. The patient started complaining of headache and hair fall. Again, Lycopodium 200 was repeated again. But headache reduced, but hair fall persisted. Patient was advised to repeat the test after 3 months. TSH value was raised than the previous one. So now, is it good or bad? So, what can we do now? Was it the remedial mistake or the dosage? What can we think? Can we change the remedy now? We should change the remedy or not?
No, sir.
What can be done?
Sir, actually, when
The
you
headache,
give the medicine,
again, she was complaining of headache. The hair fall persisted. Yeah. Yeah, please continue.
when you gave the medicine, after 3 months you got tested and it was normal.
Okay.
So the medicine what was selected was correct.
Okay.
The potency has to be changed.
Okay. Then see what happens. See, this is the report. On 24th of December 2018, when she came for the first visit, it is 11.06. Can we all appreciate it on the slide? It is visible. Is it visible to all of you?
Yes, sir.
Okay.
Sir, individually they can zoom and see.
Yeah, fine. Then this is the second time. It is on 19th of April 2019. It is 5.6. This is on the third visit, which is on 27th September 2019. The TSH value raised to 8.9. Okay. Is it visible now? So what shall we do for this case? As Dr. Harsha said, the higher potency was prescribed. Lycopodium 1M was given 2 doses for 2 months. Then the thyroid profile was advised after 2 months. After 2 months of it, The TSH level came down to 3.8 on 23rd November 2019, 2 months after that. Is it visible? So this is the power of potency. If you are sure that remedy is right after the case, if there is any problem with the dosage, you should adjust the dosage to the patient's need. You should change the potency and you should vary it. In your clinic also, when there is a paucity of symptoms, before changing the remedy, first think of changing the potency. If you are right with the remedy. So again, nowadays, now we are facing a problem of COVID-19. So this is the study of COVID-19 cases in Italy. There has been a study, and I have highlighted it. In each individual case, only one single component homeopathic medicinal product has been diagnosed and prescribed at a time with only one potency, chosen individually according to the symptoms presented 18 during the same homeopathic treatment and single medicine. So, as we all know, the COVID-19 positive cases are syphilitic in nature. So, they are not given the clear picture of potency what they had used. I think maybe 200 potency. So that in each individual case, the potency is 200 what they are given. And the detailed study has taken care after that. All the patients are better after prescribing these followed medicines which you can see in the last lines. So what is the takeaway message?
Slide ಕಾಣ್ತಿಲ್ಲ ಕೋವಿಡ್ ಸ್ಲೈಡ್ ಕಾಣ್ತಿಲ್ಲ
ಈಗ is it visible?
ಇಲ್ಲ ಇದು previous slide last ಬಂದ್ಬಿಡ್ತೀವಿ
Sir, this was the report.
Report clear ಇದೆ next slide ಕೋವಿಡ್
That yeah. Now sir?
ಇಲ್ಲ ಬರ್ತಿಲ್ಲ ನಿಮಿಷ
ಬರ್ತಿಲ್ವಾ?
ಕೋವಿಡ್ ಬರ್ತಾ ಇಲ್ಲ
ಸರ್ ಈಗ
ಇಲ್ಲ
ಬಂದಿತ್ತು ಸರ್ ಬಂದಿತ್ತು
ಈಗ ಬಂತಾ?
ಬಂತು
ಓಕೆ
ಬಂದಿದೆ ಕಾಣಿಸ್ತಾ ಇದೆ.
Okay. So this is the thing. So we should be very sure with the potency. So what is the takeaway message? In psoriatic cases, for example, conjunctivitis, appendicitis, rhinitis, any psoriatic cases, after taking the case, after the remedial diagnosis, the prescription, we can base it on 1M, 10M and above, and repetition may require in the acute cases. So it depends on the case, so you can treat. What is the psychotic cases? In psychotic cases, we can also give 3, 6, 30 potencies and 200. The repetition may not require. After prescribing the medicine with the potency, we can wait and watch till the improvement ceases. When there is a suggestion of improvement, then we can repeat the dose according to the case. In syphilitic cases, can give 200 potency and the repetition is required till the curative results come. Okay, so we must individualize the cases. Low potencies will not cure acute diseases, all infants nor all age persons, nor high potencies cure all forms of the disease. All potencies are required. Any potency may be required in any given case. So all the practitioners should be available with the potencies. So that any potency may be required in any given case, we should be ready to prescribe the potencies according to the case. So any questions? Any questions? Is it all clear?
Sir,
In frank
Yes.
syphilitic cases, like very
Yeah.
suddenly, like sudden MI and sudden
Yeah.
acute, but the background
Yeah.
miasm is syphilitic. So what
Syphilitic.
would be
Yeah.
the potency? Yes.
200 is that potency. Hello?
ಎಲ್ಲರಿಗೂ 6 ಮಂತ್ ಉಪಯೋಗಿಸೋಕೆ ಭಯ ಅನ್ಸುತ್ತೆ, ಯಾರು ಕ್ವಶನ್ಸ್ ಕೇಳ್ತಿಲ್ಲ ಅದಕ್ಕೆ.
This whatever it is, it's according to the 5th edition of Organon, right? See, in the 6th edition, there is totally a different set of instructions.
ಅಣ್ಣ ಹೇಳೋಣ ನೀನು ಏನಿದೆ ಹೇಳ್ಬಿಡು.
ಇದಲ್ಲ, ಇದು 5th, 4th, 5th ಎಡಿಷನ್ದು. 6th ಎಡಿಷನ್ ಅಲ್ಲಿ ಟೋಟಲಿ ಪೊಸಾಲಜಿನೇ ಡಿಫ್ರೆಂಟ್ ಇದೆಯಲ್ಲ, ಬಿಗ್ ಕನ್ಫ್ಯೂಷನ್. ಸುಮಾರು ಜನ ಕೇಳ್ತಾ ಇದ್ದೀನಿ ನಾನು. ಅವರ್ ಪ್ರಾಕ್ಟೀಸ್ 90% it is influenced by Kent, right?
Okay.
But Kent time only there was no 6th edition published.
Okay.
It was between 4th and 5th edition. What till today?
So I'll quote some of the Kent's example. Hello.
ಅಣ್ಣ 6th ಎಡಿಷನ್ ಎಲ್ಲ ಇಳಂಗ ಮಾಡ್ತಾರೆ.
Okay, right.
Sir, I'll quote some Kent examples. Can I quote it, sir?
ಹೇಳೋಣ.
So Kent, what does the Kent says as a rule in chronic cases, especially 2 doses. Some cases may require 3 doses in the same plane give the best results. What the Kent says. 3rd dose in the same potency gives no effect, according to Kent only. And also Kent says very high potencies seldom require repetition to produce long curative action. But in severe acute sicknesses, several doses in quick succession may require in severe acute sickness. In typhoid also Kent advises to repetition. In remittent fevers has to be repeated. The Kent says. These are all the Kent advices what he has given. Hello?
ಗುರು ಇವೆ ಸರಿ.
Okay.
ಓಕೆ.
Water
ಕ್ವಶನ್ ಸುಧೀಂದ್ರ ಅವ್ರದ್ದು ಬೇರೆ ಇತ್ತು. Kent ಟೈಮ್ ಅಲ್ಲಿ.
Okay. I understood that. Yes. Definitely, sir. It will be taken part by Dr. Irango, sir. Any other questions?
ಎಲ್ಲ ಸೆಂಟಿಸಿಮಲ್ ಸ್ಕಿಲ್ ಬಗ್ಗೆ ಆಯ್ತಲ್ಲ, ಸಮಥಿಂಗ್ ಅಬೌಟ್ ಮಿಲಿಸಿಮಲ್ ಅಂಡ್ ಮಿಲಿಸಿಮಲ್.
That will be taken care by also Dr. Potency will be taken care by Dr. Irango, sir.
Okay, thank you.
Okay.
What of things?
okay. Thanks to Dr. Gurukiran